driving as we are live on City 7.
I parked just for you for Chief Short. What? I knew I was going to have to be commuting at the time, so I was like, as soon as he starts, I'm parking.
Just didn't want to get you caught in any road rage on live.
I lived in DC. This is nothing. There's no road rage. There's no traffic here. It's fine.
Okay, good morning, everyone. Let's go ahead and get started. We'll see as a few more keep logging in here. We'll get going. Thanks, everybody, for coming on to this virtual meeting. It's been 7 months since we've had a meeting, and I realize that's quite a while, but as I'm sure everybody's aware, there's this little thing going on that we probably have all been in the same meetings anyways, so it hasn't really been that big of a deal at this point, but I thought we needed to get back on track where we were in meeting monthly. So we'll try to do these virtually. Just so you know, as we meet virtually with the city now, because we're not doing any in-person meetings, that virtual meeting is also being produced live so the community can see it, just like it's open to the public any other time. So this is being put on YouTube and City 7 at the same time as we're doing our meeting. So I know that we have a tendency in our meetings to maybe hit some HIPAA related things. So just be careful not to get into any of the HIPAA related. If we have to, at some point, we can do a executive session beyond that. Again, I want to apologize because we haven't met, but I really think that, you know, seeing most of the names, numbers, we've all been doing the same things over these past few months. So I'm going to keep it pretty basic. And for today, everybody has a lot of things on their plate. So I'll go down our list, our normal list of agenda, and probably what'd be best if just kind of summarize the last 7 months and any major things that you want to touch on. We don't have to get in details on the statistics and everything this month, and we'll just get into the month by month again next month instead of trying to do 7 months of stats and everything through this meeting at this point. Janelle did send out the AMR paperwork for the last 3 months. If you want to take a look at that, that should have came back in through the meeting reminder. So it's in the meeting notes for you to be able to click onto those. Okay, so let's start off this morning with just some scheduling issues. Of course, our 2020 meetings will probably continue this way through the remainder of the year. I don't see us opening up in any way to or in-person meetings. So we'll probably continue on with this as it's with the city phasing guidance. We'll be staying in virtual meetings with the exception of only those chartered required meetings. They'll get that opportunity to meet in person. So let's start off first with AMR. You want to review a little bit of what's going on in the last 7 months?
Yeah, sure, Max. Since we're not going to do the monthly report statistics, I'll just go ahead and just give a brief overview and kind of let you off the hook for a little bit. For the first thing probably to discuss is just a recap of the BLS resource deployment. That's actually been going very well. We're looking at a new schedule model to add more BLS trucks. What we're finding is having them to run the transfers and then back up some of the low acuity 911 has been advantageous. It's taken a lot of pressure off of the ALS trucks, which is a segue into the next issue, which is staffing. So over the last 8-9 months, us as well as probably every other ambulance provider out in the Kansas City area has had issues with paramedic recruitment. I'm happy to say that we're probably better now than we have been over the last year. We still got 2 spots that are open. We do have a couple candidates in queue and 9 additional EMTs that are currently in school, probably 5 of which should be done within the next 3 to 4 months. So we're hoping that that will bridge the gap on any staffing issues that we've had. We are sending 4 to paramedic school at MU, paying their way. So with that, they'll have a retention requirement, which will help for long-term. And then the only other thing I think I've got is just to touch on transfers. You know, we've had some poor performance in terms of response times to center point for transfers, mainly because we're keeping our resources what we call CVL. We're keeping it. Other than that, that's really all I've got.
Okay, thanks, Paul. Anything else from AMR?
I don't believe so. Pete's not on the line. I am not aware of any clinical issues that's come up. We've had some small scale stuff that Craig and I have discussed back and forth, but nothing of a grand scale.
Okay, thanks. Dr. Duncan, are you on? I know there's a couple of phones calling on. Are you on this call? Doesn't appear to be. Okay, Craig, Chief Duplantis, would you like to give us a report for the fire department?
As soon as I unmute, as you are well aware, and everybody that's in the city has been able to, clearly see, our hands have been quite full with everything that's been going on since the spring. From a fire department perspective, we had that initial dip in our call volume where everybody was kind of afraid to go outside, but they quickly lost that, and our volume returned to normal levels and has even trended up. And I'm sure AMR is aware of that as well. The overall performance for us, I think, has been pretty good. We've kept our people pretty safe. We've run into, initially we had, well, nothing as far as staffing issues. Our people were basically locking themselves into work as opposed to staying at home. Life being what it is, we've had our various issues since then, just incidental contacts, and the amount of contact we've had with members of the city has opened us up to some quarantine issues. But overall, we've had a very small number of positive cases, which is really pretty neat. So I think that's down to a lot of groundwork that our people are doing as far as PPE stuff. Speaking of PPE, we've also taken on the role of kind of wrangling PPE and being the single point of contact for ensuring the facilities and different groups around the city have what they need to allow them to do their job safely. Done a lot of work between that and myself, the EOC, and some other partners in the city, trying to just ensure that the employees are kept safe and they have what they need to continue to provide services. That's taken up a pretty fair amount of time. As Paul spoke to, clinically, only minor issues. We try to stay in pretty good contact and talk back and forth about differing, crew management issues. Very, very seldom do we get into a operations issue where we've got an issue with care delivery. So that I've been pretty happy with that, but we get into little things here and there and we try to work them out as we go. So other than being pretty busy, I think everybody's kind of juggling the chainsaws as they can right now. So we're not doing too bad. I don't know if there's any specifics, Chief, that you want me to get into, but we're keeping our head above water, which is I think about all we can ask.
Probably the only thing that I'll point out is next month when we start getting a little more detail, we should see some better response numbers for us as we've gone to proximity. And that has reduced some of our 90th percentile times in a very good way over the past 6 months. So we started that right at the 1st of February, somewhere in that area, and seem to have some positives out of that at this point. Okay, anybody from Centerpoint like to give a report?
Good morning. Can you hear me okay?
Yes, go ahead.
Hi, this is Maggie, STEMI coordinator. Good morning to all. I would just like to kind of I think I went ahead and sent you our TCD report card, Chief, for September specifically. Now we have had 10 total STEMI activations, 6 of which were called out from the field, and 8 of them were brought in by EMS, and there were 2 walk-in patients, and total activations with interventions were a total of 5 patients, and 2 were canceled. So the first EMS contact to 12-lead EKG median in minutes for September, it's been great. It's been 5 minutes, which is an AHA goal. The other opportunity that we have, though, is the EMS contact to activation time. And our median average time for September was 30 minutes. Of course, the goal for AHA is 10 minutes on that one. And there are multiple reasons for that delayed activation, though. One is there were patients that are really truly sick, and there were 2 cardiac arrest patients that was brought in, and one of them was really sick, critically ill with Impella and temporary pacemaker stuff that we had done in the ED. And so that's the only thing that I had kind of wanted to kind of reiterate is the EMS contact to activation time. I believe we did the first medical contact metric detail per NCDR that I have actually emailed through you, Chief. That's the one that was pretty repetitive that on our meetings that we know that we are fast. We know that you are fast, and but we can be faster, and there are some opportunities to that for the first time EMS first medical contact to balloon time is still prolonged, as evidenced by the prolonged EMS contact activation time. So we could do better on that one. So that's really it.
Okay, thanks, Maggie. I'll get those reports out. Yes, I did receive them. I'll send those reports out to the committee as well so that everybody can see that.
All right, thank you.
Anybody else from Centerpoint?
Jamie stepped out for the time being to see a patient, so she won't be joining in, maybe hopping in later on our call. So.
Okay, thank you.
Thank you.
Hey, Chief, it's Tina York.
Yes.
Hey, I just wanted to give you guys I mean, most of you on probably already know, but just from an overall EMS standpoint, all of our facilities are continuing to run reports through myself and my counterpart, Darren, so we can give you guys a heads up when we have positive COVID patients that AMR has transported. We have been sending those reports out. Also, we've been doing really ramping up this past month and in through the year. We have several education opportunities, and we've been doing them virtually. We've actually had a really great success so far with the ones that we've done. We've been at minimum getting between 20, 30, up to 50 participants, I think, because so many people have gone without continuing education for so many months that people are trying to play catch up now. So that's been very successful, and I'm glad we've been able to launch all of that. And then I think, well, that's it. I had 2 notes. I think that was it. So just want to give you guys an update with that.
Okay, thank you, Tina. I appreciate that. Do I have anybody on from IPD who would like to give a report? Okay, so let's talk a little bit about emergency preparedness. I'm trying to stay away from the C word as much as I can, but we'll have to get into it a little bit. Christina, do you have anything you would like to report from health department wise?
I mean, there's no way not to say the C word. If nothing else, we'll just say our confirmed cases across the nation, of course, are going up, and across the region are going up. Missouri's not doing well. Our region is not doing great, even though some of our confirmed cases are going down, but a lot of it seems to be because our testing is down. The city plans on this next week starting some COVID testing of their own in order to try to help get those testing numbers up. Our goal is to do about 1,000 tests per week for about the next 7 to 8 weeks. So we're gonna try to start that this next week. The goal is to do up to 7 days a week of testing. We're gonna do our absolute best, relying a lot on volunteers, and we're extremely thankful for that. But we'll be getting out more information about that probably tomorrow.
Okay, thank you, Christine. Dante, do you have anything you'd like to inject today?
Oh, I would just say, Chief, that Christina summed up the most critical circumstances affecting us now. But just for those that might not be aware, there is a regional multi-agency coordination system that's involves the Healthcare Coalition, and which includes hospitals and EMS and public health and private sector partners, as well as the other
nice guy,
as well as some other sections involving the district and so forth. And we're part of that. So that's ongoing, and we're trying to keep abreast of the somewhat deteriorating situation that Christina just described. So that's where we're at. Oh, also we have our Medical Reserve Corps in full operational mode. It has been, and since pretty much the start of the COVID pandemic, and they will be assisting with the testing project that's Christina described that we're going to do in Independence. So that's just a quick thumbnail sketch of what's happening from emergency preparedness point of view.
All right, thank you, Dante. And I don't know if you want to mention also that not only are we going to be doing the testing, we've applied to be to help with the vaccination process using MRC and heart to heart.
That's yes, and we're underway with developing the capacity to do those vaccinations, and it is I have to say, it looks to be a kind of a challenging process. That's first time that I'm aware of the nation has kind of organized this massive vaccination effort. So they're building the vehicle as they're driving it forward, but there'll be a lot more to come on that. We're adapting a public health emergency response trailer to do to support the vaccinations, and working with Heart to Heart International, which is a not-for-profit voluntary agency based here in Kansas City that has a lot of experience in doing this kind of work around the world. But this will involve this process, or this project will certainly involve all the key stakeholders, hospitals and all medical staff, frontline medical staff, and will be, the first to be inoculated and so forth. So there will be a full-blown plan. The states of Kansas, Missouri have already developed these plans, at least our first draft, and they've been submitted. So they're working to now get those approved and implemented at this stage. So more to come on that.
Okay, thank you, Dante. Does anybody have anything else for the good order today? Okay, nothing being said. Thank you, everybody, for joining this session, since again it was a early, just kind of to get us back into the movement, or the forward movement of the committee. Next month we'll meet again this way. We'll probably get a little more detailed in statistics on that meeting, and get the reports out as well. So if nobody has anything else, thanks everybody for coming today.